Alrighty, you've had your blepharoplasty and now it is the first post-operative day, and what's important in that first post-operative week or so after surgery. Here's the thing, the first post-operative night that's very important. It's important you have somebody with you, caring for you, and that they are putting iced soaked gauze on your eyes. That first night, that's super important to help reduce the swelling in your eyes and give you comfort. And believe me, it is really comfortable when you do that. So make sure that person's kind of committed to stick it out with you that first night and change those gauzes for you regularly, because that'll make your night a whole lot better that first night. Your eyes the first night won't be too swollen, but as the night progresses and into the next day, they're going to become more swollen. Sleep a little bit upright that first night. That's going to help reduce that swelling, but nothing's going to make it go away completely, so just plan on it. Usually by about day 2, the swelling is as bad as it gets, and then it's going to get better from there. You're going to have little stitches in your eyes. We're going to take those out on day 5, and then the stitches should be removed, and you should be well on your way to recovery. Here's the other thing that you need to do to really help your recovery, though, in those first few weeks. And I want you to continue this for a month or 2 after surgery. And it seems like a lot, but it's super helpful. And that is, you've got to be responsible to take care of making sure you don't get dry eyes. When we do a blepharoplasty, it affects our oil glands to our eyes. It affects that oil production, and it's going to dramatically decrease our own body's ability to keep our eyes moist. In addition, when we've done a blepharoplasty, your eyes are more open now. So surprisingly, they're more affected by things like air and wind and things like that. So we're going to give you a lubricant that you're supposed to use at night. That's a thick, oily gel that you put in your eye, right on your eyeball. And you put that in there every time you're sleeping and resting your eyes. It's going to make your eyes blurry. If it's not making your eyes a little blurry at first, you don't have it in the right spot or enough of it in there. When you're up and about and doing stuff, which you can, except for chores. I don't want you doing chores or work where your head's down that first week at all. Your head needs to be up and elevated. You need to be sleeping a little bit up and elevated. But during the day, when you're up and walking around, you're going to put a lubricant in your eyes. That lubricant has to be put in like every half an hour or hour, so you really are keeping those eyes lubricated even when you're not feeling it. If you're not feeling like they're dry, if you're not feeling like there's any problems, you're not going to be given a cue to put anything in. So you've just got to plan on doing it and do it regularly to make sure they don't get dry and make sure they don't have any problems. Additionally, if you've had an upper and lower eyelid surgery, you're going to have another medicine that we prescribe. Now that's different than the lubricants, not to be confused with the lubricants, not to be used like a lubricant. It is a drop, but it's a medicated drop that's a steroid and antibiotic drop that we give you to try and decrease inflammation in your eyes. That's helpful in the first 3 to 4 days after surgery. It's only a twice-a-day medicine for 3 or 4 days. Do not use it beyond that unless you're specifically instructed to do so. Again, this is not a lubricant. It doesn't lubricate your eyes. It's a medicine to reduce inflammation, and it will say that on the packaging. So read that and make sure you got the right ones. You're not putting the wrong ones in for the wrong purpose. And otherwise, your surgery and recovery should go very smoothly. Usually you'll be off pain medicine immediately. Most people don't take pain medicine for their eyes. We do give you an antibiotic, we do give you an anti-nausea medicine, but most people don't take the anti-nausea medicine either, as blepharoplasty patients typically do not have a lot of nausea. Recovery is usually pretty smooth and pretty easy. If there's any problems, when we see you back in clinic, we'll give you advice regarding that and what to do to correct anything.